Assalamu alaikum. Today our topic is perineum. Perineum is the main essence of the pelvis part and it is very important regarding the examination point of view. Perineum is as well as boring and difficult topic and you have to concentrate on the lectures so you can absorb all the stuff that is written in the books. So it's important to have proper concepts of the perineum. Perineum is a part which lies below the pelvic inlet, right? So below the pelvis there is a part which is perineum. Perineum is a triangular area like that. This is triangular, diamond shaped area. So this diamond shaped area is known as perineum and it is lying just below the pelvis. So perineum is different of according to the genders. Female and male perineum have different relations due to different external genital organs and reproductive organs, right? But there are some similarities in both perineums, which will be the nerves and arterial supply and the muscles, right? So we have the superficial perineum and the deep perineum. We need to understand the concept. The boundaries which are superficial are the one which we can see without dissecting, and deep boundaries are the one which we will see after the dissection. So what should be the superficial boundaries? As perineum is a part which is covering the genital organs, so in the superficial boundaries, anteriorly there will be scrotum in the males and mons pubis in the females, while posteriorly you know that buttocks are the part which are forming posterior relation of the perineum, while on the each side there will be the medial side of thigh. So now you have the better understanding that the portion of external genital organs is perineum and anteriorly scrotum in males, mons pubis in females, buttocks which is posteriorly, and each side there are medial side of thigh. So these are the boundaries which are superficial and we can see without dissecting. When we dissect, we remove the skin, we can see the structures, and that are the deep relations of the perineum. So deep boundaries, anteriorly it's covered by the arcuate pubic ligament and the pubic arch, while posteriorly there will be the tip of coccyx. If you see the model here, arcuate pubic ligament lies here and that is the pubic arch. So anterior relation will be the pubic arch and on the posterior side that is the coccyx. So coccyx will form the posterior relation of the deep perineum, and anterior perineum will have arcuate pubic ligament and the pubic arch. While if you see the sides, on the sides there are ischiopubic rami which are connecting the pubis and ischium, and then we have the ischial tuberosity. This is bony landmark is the ischial tuberosity, and then we will have the sacrotuberous ligament. This is the sacrotuberous ligament. So sacrotuberous ligament, ischial tuberosity and ischiopubic rami are present on each side of the deep perineum. Now perineum is divided into two parts. That diamond area is divided into two parts, and the part that is dividing the perineum into two parts, that bony landmark is known as perineal body. That perineal body divides the perineum into anal region and the urogenital region, right? If you can see here in the model, this is the female perineum model, and in the female perineum model you have to see in what is the center of this model. This is the center of this model, right? This white landmark. So that is the perineal body. Perineal body will divide this diamond shaped area into the urogenital region and the anal region. Where anus is present, that is the anal region, and where genital organs are present, that is urogenital regions. If you can see here, we have the three openings. The first opening is the urethra, then we have the vaginal opening, and this third opening is known as anal opening. So we have urethra, vaginal opening and anal opening, and that part is the urogenital region and that part is the anal region. Now in the urogenital region, we have two openings. One is for the urethra and one is vaginal opening. Because it contains the uro and genital both opening, that's why this is known as urogenital. And anal canal and anus is present here, that is why this area is known as the anal region. If we discuss about the anal region have the termination of the anal canal and opening for the anus present, and in anal region we have very important part, that is ischio-anal fossa. In the anal region, on both sides, on the lateral sides, or you can say on the each side of this anal canal, we have fossas. That fossa are known as ischio-anal fossa, which are present bilaterally on the both sides. So these depression present laterally are the fossas, which are known as ischio-anal fossas. And urogenital is the one that contains the urogenital organs. Now this anal and urogenital region both are supplied by a chief neurovascular bundle that is known as pudendal nerve and internal pudendal vessels. Pudendal nerve and internal pudendal vessel collectively form this neurovascular bundle that is passing through the pudendal canal. So here we have these pudendal nerves, the yellow one, and the red ones are the internal pudendal vessels. So these internal pudendal vessels and pudendal canal are part of the perineum, and they are forming chief neurovascular bundle and supplying both anal region, and you can see branches are going upwards to the urogenital region. If you remember this model, you have clear concepts of this model. There is no difficulty to memorize the perineum. So please try to identify every part of this model and try to identify the boundaries. Then you are good to go. Now we will discuss the anal region in detail. For the anal region, first of all, anal region has two fascias. One is the superficial fascia and one is the deep fascia. Anal region superficial fascia contains large amount of the fat that will be filling the ischio-anal fossas. These fossas will be filled with large amount of the fats and forming the superficial fascia. Then in the deep fascia, we have the deep fascia is formed by two fascias. One will be the inferior fascia of the pelvic diaphragm, as I already mentioned, that where the pelvis ends where the pelvic diaphragm is present, right? So the fascia from the pelvic diaphragm comes, and also fascia covering the obturator internus muscle. They both muscles form the deep fascia of the anal region. And anal region also contains the perineal body that is present at the central part of the perineum, and it is a fibromuscular coat, and it is formed by the 10 muscles union, and it supports the uterus. Those 10 muscles we are going to study in detail when we will discuss the chapter female reproductive organs, and we will see the supports of the uterus. So let's just say this is the perineal body and this is the central part, and perineal body is formed by the fibers of the 10 muscles. These are the levator ani fibers, and there are other muscles which come and form this fibromuscular coat, and that is known as perineal body. So anal region contains external anal sphincter. This is the external anal sphincter. This is anal opening. These longitudinal circular cords that are covering the anus opening are known as an external anal sphincter muscles. So external anal sphincter muscles, perineal body, anus opening are the parts of the anal region. Then you can see we have the coccyx here, and the way anus opening and coccyx are attached, that is known as the anococcygeal ligament, while these are the fibers of the gluteus maximus muscle, and all these fibers lying are the fibers of the levator ani muscle. Levator ani have three parts. One is puborectalis, then we have pubococcygeus fibers, and then we have anococcygeus fibers, right? So anal region have superficial fascia, deep fascia, that perineal body, and that external anal sphincter that covers the anus, and it is voluntary in nature, right? Now nerve supply of the anal region. Anal region is supplied by the inferior rectal nerve and perineal branch of the fourth sacral nerve. Inferior rectal nerve supplies around anus and over ischio-anal fossa, while perineal branch of the fourth sacral nerve will supply the skin only posterior to the anus. That inferior rectal nerve will arise from this pudendal nerve. Pudendal nerve is giving different branches. The branches which are present around the external anal sphincter, these are the inferior rectal nerves. So these inferior rectal nerves are supplying this anal region and also the perineal branch of the fourth sacral nerve. After that, we have ischio-anal fossa to discuss in the anal region. Ischio-anal fossa, you can see, is a VIP question that is frequently asked